Good afternoon, everyone. I am so pleased to join you today on the territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations, and particularly excited to be on the site of the new St. Paul's Hospital, which, as you can see behind me, is coming up very, very nicely. Massive expansion of healthcare for Vancouver, for the province. Very exciting to have a chance to see it as it's coming up. My name is Jennifer Whiteside. I am BC's Minister of Mental Health and Addictions, and I am joined today by some very special guests. We have Vicki Waldron, the Executive Director of the Construction Industry Rehab Plan. Welcome, Vicki. Thanks for being here. And Dr. Andy Ryan, Addiction Medicine Physician at St. Paul's Hospital and the Medical Director of the Road to Recovery program at Providence Healthcare. Thanks for being here, Dr. Ryan. And we're joined today as well by some very special friends and folks who are really working through this crisis with us. We have folks here from Providence Healthcare, from health authorities. We have Bryn Bork from the building trades. We have Brooks Patterson, who is on the Construction Industry Rehab Plan board and is a CLR rep to that board. And it is reflective of the importance and the breadth of the organizations and the individuals who have come together to stand up services, to provide pathways to care, to build new and innovative ways of reaching people who are struggling with substance use disorder and in particular opioid use disorder in our province. And we're here to talk about an important expansion of services and new pathways to care. But I just want to take a moment really to reflect on how far we've come in the past few years and just remind everyone that it was about in 2011 that a new form of highly deadly, highly addictive synthetic opioids started to hit the streets in our communities and other communities around North America. And that problem started to grow and has posed such incredibly challenging care issues for the doctors and the nurses and the community health, mental health workers who are out on the front lines of this crisis. And I would say that, we, for some time, for a long time, that problem was ignored. Treatment was hard to find. Loved ones were left on their own to struggle through this crisis. And since 2017, we have been doubling down on our work to expand access to mental health care, to prevent addiction, to build up a comprehensive treatment and recovery system of access so that people can get the care that they need. And before the pandemic, I will say we were tackling the toxic drug crisis head on, and we were making important progress. We saw in 2019 a significant reduction in mortality. And then the pandemic hit. Mental health issues soared. The impact of the COVID pandemic was particularly tough for vulnerable people. And we know that folks fell through the cracks. And that impact of the COVID-19 pandemic bedeviled all of our work and set us back. But the toxic drug crisis that we are fighting today is more complex. It is much tougher than what we were dealing with 10 years ago, even 5 years ago. And we are not alone in this fight. British Columbia, Alberta, Saskatchewan, every province across our country, across the United States and beyond, communities are grappling with this crisis. We know that last year was the worst record on year for toxic drug deaths in Alaska, in Alberta, in Washington, as well as here in BC. But we are very grateful to see that the rate of death is slowing in BC this year, and it is at its lowest point since the pre-pandemic period in 4 years. And I know that the over 14,000 people that we have lost to the toxic drug crisis since it was declared a public health emergency in 2016, I know that the individuals that we have lost have left unfillable gaps in the lives of their communities, of their loved ones, of their families. And there is very little that we can say to bring a salve to the wounds that are left. But there is hope that we are moving in the right direction. But there is no easy fix, there is no silver bullet, there is no one single solution in this crisis that will solve the problem. There is no vaccine for the crisis that we are in here. And that is why we are taking action to do every single thing we can on every single front to save people's lives and to support them on a path to recovery. And we are being innovative, we are adapting every day, we are making changes to how we do this work every day. It's not easy, and it takes a toll, and I want to stop for a moment to recognize the first responders across the province who are often first on the scene and who do such incredible work to respond to overdoses, to work to connect people to care, who are part of programs that we are developing to be more responsive and to create more connections for people to our healthcare system. And to all of the peer workers out there who are working with teams in our health authorities, who work with overdose outreach teams to really meet people where they're at. Your work is literally saving lives. We have to do everything possible to keep people alive first so that we can connect them to care. And we know that the vast majority of people who are dying from poison drugs are using alone, and they die alone. People who are afraid, people who feel shame, do not reach out for help. And the risk is that they will not be alive to take that step to connect to care. That is what is at stake here. That is what is at risk here. That is what so many healthcare workers, doctors, nurses are dealing with every single day across this province. I mean, and it's why we support programs and we develop programs like supporting the use of the Lifeguard app, which alerts 911 if an overdose is occurring. That has been a phenomenally successful approach. We've had over 144,000 users of that app, uses of that app from nearly 55,000 users across the people who have downloaded that app and have used that app in order to avoid an overdose. We know that the work that we do in overdose prevention sites has saved, according to the coroner, over, far in excess now of 8,000 lives. I'm so proud of the work that we are doing with the construction industry on all fronts, from delivering naloxone kits, from the working with employers and the union on the tailgate toolkit, to the supporting the development of the Build Strong app, which is the work that the construction industry rehab plan is doing, and all of the work across all of those tables with the employers, with the unions, with the skilled trades training programs to support prevention and to get build relationships and provide support and education to workers before they're on a job site or before they're injured or before they wind up dealing with a chronic pain situation. We also recently announced really what is the ultimate transformation of our healthcare system in supporting and caring for people who are dealing with opioid use disorder, and that is the Road to Recovery model, which was developed at St. Paul's Hospital by addictions medicine physicians and experts in addictions medicine. And it is literally providing a completely a seamless approach to how we provide care, from detox to aftercare. We are expanding that program across the province to every single health authority. We are treating opioid use disorder, substance use disorder, as the health condition that it is. We are pulling it into our healthcare system. We are connecting it to all of the other supports and services that people need in order to be successful on their recovery journey. The Road to Recovery provides people with seamless, integrated care from assessment and detox to treatment and aftercare with, and this is the really important point, with continuity of care by the same clinical team all the way through. And it doesn't matter how many times somebody walks up to that door, and maybe they can't walk through it the first time, maybe they get over the threshold the second time, maybe it's more times before they actually get in the door and have a relationship with a provider and are getting the care that they need. Their life is worth saving, and we're going to do everything that we can to make that service and that care available to them, no matter how many times it takes. We will be there for them. From October 2023 to June 2024, more than 1,500 people have been supported to access detox services in the Greater Vancouver area through this model. So you can imagine the impact of this once health authorities have scaled this up across the province. I will tell you, we are not going to stop doing the hard work to save people's lives and help them connect to the path to recovery. And today is another really exciting example of the work that we are doing in this regard. I'm so proud to announce that we are launching a new phone line to connect people to opioid addiction medication and treatment. The Opioid Treatment Access Line is a provincial phone number that anyone can call to get assessed and get connected to treatment. And that number is 1-833-804-8111. If you are struggling with opioid addiction, you can call this number and get connected to a healthcare team. They will talk to you. They care about you. They want to understand what you're going through. They will help assess your needs. They will provide you with a prescription for opioid agonist treatment. And Dr. Ryan is going to talk a lot more about the details and technicalities of what exactly that is. You will be able to pick that prescription up at your local pharmacy. And they will also work to connect you with a healthcare team in your region for additional treatment and care as needed. In rural and remote areas where there may be few prescribers for a medication such as this, or for people, again, who are still suffering from the stigma imposed on them, or who may be embarrassed to speak to their doctor or nurse about their addiction challenges, or who have other barriers who might prevent them from seeking out care in a clinic. This is a service that they will be able to access to connect to care. We will continue to do this work to save lives, to build out pathways to care, because we are determined. We are determined to turn the tide on this crisis in our community. We are determined to do everything that we can to save lives and connect people to care. I am so grateful for the incredible work being done on the front lines of our healthcare system, across our first responder system, and in communities across the province by community organizations and peer groups to support people during this crisis. I would now like to invite Dr. Andy Ryan to the podium to provide some more details. Thank you.
Thank you. Good afternoon, everybody. My name is Dr. Andy Ryan, and I'm an addiction physician at St. Paul's Hospital. I'm also the medical director for the Road to Recovery program at Providence Healthcare. I'm very grateful to be joining here today on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. I'm also very grateful to have been invited to come and speak about the launch of the Opioid Treatment Access Line. I've been an addiction medicine physician for the last 10 years, and like my other colleagues, I entered into this profession with a desire to help people who are struggling with addiction. Many people who use substances not only live with the daily burden of their addiction, but carry with them the stigma and shame that come with addiction, making it incredibly difficult to get help. It takes a lot of courage. Even when they take that risk to reach out for assistance, understanding where to turn for support is often unclear. Sometimes they experience stigma within the healthcare system itself, and often they face delays, which are extremely discouraging. Many folks I have met have shared that they would have engaged in treatment sooner if it wasn't so challenging to get connected. It's crucial to simplify how people living with opioid addiction can access care in a fashion that is timely and where they're treated with dignity and respect. One of my greatest frustrations are those missed opportunities to provide care for someone when they're ready. For too long, it's simply been too hard to get treatment and care in a timely way. But that is changing. The launch of the Road to Recovery at Providence in partnership with Vancouver Coastal Health and its recent expansion across the province means that people will have access to a seamless, continuous system of addiction treatment that supports them where and when they need it. And now, with the launch of the Opioid Treatment Access Line, people living with opioid addiction have a simple, coordinated point of access into this broader, improved system of care. That care can now start with a phone call and a conversation with a trained addiction specialist who can prescribe life-saving medications and connect them to ongoing care in their community. The medications we provide are called opioid agonist treatment, or OAT, which are evidence-based treatment for opioid use disorder. These medications provide relief from withdrawal symptoms and reduce cravings in people with opioid use disorder, which helps them reduce their use of opioids and significantly reduces the risk of overdose and death. Of course, accessing and starting treatment is only the first step. Being able to receive continuous care is critical. Something as seemingly insignificant as a prescription running out can interrupt a person's treatment and recovery. There are many reasons why this might happen. A missed appointment because their care provider lives 2 towns away. They're admitted to hospital with a different health issue. These are not uncommon occurrences for people with an opioid addiction. This service will act like a safety net to provide short-term prescriptions until they can see their usual provider, helping people remain stabilized on treatment so they can focus on getting well. The new Opioid Treatment Access Line will remove barriers to accessing care. Patients will not be required to present in person or to travel to be seen and access our service. 10 years ago, at the beginning of my career, I entered a system that was fractured and frustrating to navigate. Today represents another step toward building a substance use continuum of care that is accessible to all British Columbians. Finally, we are 8 years into a drug poisoning crisis, and as we approach International Overdose Awareness Day this coming weekend, it's clear that we need to find a way to help folks find sustained, ongoing protection from overdose. In order to do that, we need to help separate people from the poison drug supply. And with the current tools that we have available, the best evidence we have to achieve this for people with opioid addiction is through evidence-based treatment with OAT, which helps enable long-term recovery. So I invite anyone who is struggling with opioid use to please reach out. There are highly skilled, compassionate, and dedicated healthcare professionals that are ready to welcome you and start supporting your needs. Thank you. And now I'll invite Vicki Waldron, Executive Director at the Construction Industry Rehabilitation Plan, to the podium to share remarks.
Good afternoon, everyone. I'm honoured to speak about an important initiative that aims to address a critical issue affecting our community, the launch of the Opioid Treatment Access Line. For years, the construction industry has been known for the tough guy, macho image and the culture that exists. It's an industry where people often feel they have to suck it up, they have to work through the pain. But today, we know better. As an industry, we know better. We understand that talking about this issue, this very deeply painful issue, requires tremendous courage. Tragically, construction workers are overrepresented in the deaths due to toxic drugs. And it's a stark reminder that we need to do more to support these folk who are struggling. The opioid treatment access line is a crucial addition to the existing supports available throughout programmes like the Tailgate Toolkit or the Construction Industry Rehab Plan's opioid-free pain clinic. And more recently, in partnership with the Ministry, Construction Industry Rehab Plan's app called Build Strong. The Build Strong app is designed to put resources directly into the hands of construction workers, and it has features like self-help videos, self-help tools, self-screeners that people can use, that workers can use to help to identify whether the issue that they have requires treatment, whether it needs more help. With all of these tools, we are working really hard to change the culture in construction. We're having open conversations more than we've ever done, even in the short time that I've been with the construction sector. We're providing resources to help those in the trades who are battling addictions. Resources, like I said, like construction industry rehab, like the opioid-free pain clinic that we have. The opioid access treatment line will make it easier and faster for construction workers and anyone struggling with opioid addiction to access the treatment that they need, the vital care that they need. It will help them access this in real time. This service helps to overcome barriers like stigma and limited access to prescribers, which is absolutely crucial in some of the more smaller communities, some of the more rural areas where we have our workers. This confidential service is an essential tool to fight against the toxic drug crisis. It offers immediate access to evidence-based treatment, which are critical to help individuals stabilise their lives and reduce the risk of an overdose. The new opioid treatment access line, workers can connect with trained healthcare professionals who understand the realities and challenges of the opioid use disorder. Importantly, these professionals are equipped to provide appropriate care and support without the need for an in-person visit. This is critical, effectively reducing all of the significant barriers that Dr. Andy had just spoken about. Construction Industry Rehab Plan looks forward to working with the province to ensure that initiatives like the opioid treatment access line are effectively reaching and supporting construction workers in need. Together we can help on their path to recovery. We can help all people on their path to recovery and create a healthier and safer community of workers for everyone. Thank you. And now it's my great pleasure to turn things back over to Minister Whiteside, who will answer any questions.
All right. Thank you so much, Dr. Ryan and Vicky, for your words and for your commitment to this work. I can't quite see her nanny back there, but are we good? Okay, we're good.
Okay, thank you, Minister. For media on the phone, if you have a question, please come off speakerphone or Bluetooth. Take your phone off mute. You are not audible until your name is called. Then press *1 to enter the queue for a question and follow-up. Media, I just need to check if we have any media in the room for a question. Just please come here, introduce yourself and your outlet. And just a reminder that everyone have one question and one follow-up.
Hi, thanks for this. Travis Prasad with Global News. So one of the concerns we hear, and you touched on it, is for people wanting treatment and recovery services, there just isn't enough capacity for everyone who wants to get in. So how confident are you that people who call this new access line will get the quality care that they need and not just end up on a wait list?
What we've seen through the Road to Recovery is that people who are calling the central access line in Vancouver Coastal and need to be connected with care are getting access to detox if they need a bed. They're getting access to opioid agonist therapy if they need that. They're getting connected to care. That's the access that we're building up because we need to have it centralized. It is, we don't want people to be, or their families to be having to take it on themselves to make a whole lot of phone calls or to sit on a wait list without any sort of follow-up about how they're doing. We need to have central wait lists. A centralized process for people to come into the system. That's what Access Central and the Road to Recovery seeing the proof of that approach in that over 1,500 people have been connected to care. This opioid, the opioid treatment access line is another layer of access, another pathway in to care, where the line will actually connect directly to a clinical team who can do an assessment and then connect with a pharmacy specifically to provide access to opioid agonist therapy. So the line is operational now from 9 to 4, and certainly we're looking to scale that up as we build up that system.
Yeah, one more question just for a colleague on a separate story. 2 parents are suing Covenant House Vancouver after their mentally ill son overdosed in his room in 2022. They're accusing the charity of negligence. Wondering if you have any comment about the lawsuit or the management of the shelter.
I'm so sorry to the parents for the loss of the loss of their child. That is absolutely devastating and not an experience we want anyone to be having to go through. I'm not familiar with that story. We could perhaps follow up later when we can get a briefing on it.
Just checking. Do we have any other media in the room with questions? No. So we are going to the phones now with Rob Shaw, Check News.
Hi, Minister. The Premier mentioned today he's directed you to do a review of the, drug dispensing machine outside of Nanaimo General Hospital that gives crack pipes and cocaine snorting kits to people, and also the Fraser Health home delivery system of drug paraphernalia. Can you tell us what the review is going to encompass and how you're approaching it?
Sure, Rob. Well, just to say, it's the access that the Vancouver Island Health Authority is seeking to provide is to individuals who are some of the individuals that Vicki Waldron spoke about from the construction industry rehab plan. Some of those folks who don't reach out for services, who may experience fear, who may have or shame or stigma. They may have barriers that are preventing them from to connect with care. This provision of harm reduction services and supplies is really part of that continuum, which is about trying to keep people alive so that we can then connect them to care. I mean, what we know is that the opioid crisis has taken the lives of over 14,000 British Columbians since 2016. And despite that we are seeing somewhat of a reduction in mortality, it is still a very, very serious public health emergency, and one that compels us throughout our healthcare system to find innovative solutions to reach people. So what we want to make sure is that that when we are connecting with someone, when we are providing harm reduction services, that there's an opportunity to connect them to a pathway to care, like there is through the through this opioid treatment access line, like there is through Road to Recovery. And so that's the objective, and we'll check in with health authorities to ensure that those connections are being made. But I would note that the vast majority of harm reduction supplies are distributed through public health units, through the BC CDC, through programs like the ones that we have in place in the construction industry to provide naloxone kits and information and training about the risk of overdose and what to do in the case of an overdose. We are launching a campaign in the post-secondary sector to ensure that naloxone is available at post-secondary sites. We're doing everything possible and learning on, relying on the evidence and relying on other jurisdictions, what they have done, that appears to have been successful. So that's work that we're going to continue to do, always trying to work with what we know and adapt as we learn more to do better in this in the context of this crisis.
Rob, did you have a follow-up?
Sure. Do you know how long your review will take? And in the interim, do the vending machines still continue to operate the way they are, and Fraser Health continue to do what it's doing, or is there a pause on any of these type of things while you do your review?
Well, Rob, we don't want to pause on trying to save people's lives. We're not gonna stop trying to do everything that we can to save people's lives. We want to make sure that people are connected to care, and that's the work that we that we work through our health system to ensure happens. I mean, Fraser Health has refined their approach to make sure that's more evident on their website, that those resources are more evident in terms of people being able to connect to treatment, and now to be able to connect to this opioid agonist treatment, this opioid treatment access line as well. It won't take very long for us to work with the health authorities on an assessment of what they think about and what the clinicians on the front line of this crisis really would advise around how we can best provide harm reduction supports to people who need them, much as we did with, just making sure that people don't use dirty needles and transmit the HIV/AIDS virus. I mean, the work that we did in harm reduction on the AIDS crisis means that we actually don't have an HIV/AIDS epidemic in British Columbia anymore. That was a remarkable achievement of our healthcare system, of our public health system. And we have to acknowledge today that the vast majority of people who are dying as a result of inhalation. And so those are all kinds of very complicated factors in terms of how the drug supply changes, in terms of how people's use of drugs changes. Our healthcare system works very hard to try and keep up with a very volatile crisis that is ever changing.
Our last question is from Wolf Deppener, Black Press.
Thank you, Minister, for taking my question. I just want to come back to this vending machine issue. If I heard you correctly, based on your statements just now, the vending machines will stay in place for the foreseeable future. We know how the Conservatives have reacted to them, but how do you think the public will react to them?
I think British Columbians, by and large, understand that addiction is a healthcare issue and that we need to treat it through our healthcare system and in a way that responds to the healthcare needs of individuals who are suffering from opioid use disorder. And we will continue to rely on the best advice and best evidence of clinicians with respect to how we can best do that. It's that advice that has led to the Road to Recovery program, which is about providing access to care from detox all the way to aftercare in this province. It is transforming our healthcare system. It is transforming access for people who are suffering from opioid use disorder. We are determined to save lives. We are not going to stop until we have turned a page on this crisis.
Wolf, did you have a follow-up?
Yes, I do. And it concerns this new hotline. If I heard you correctly, it's only open from 9 to 4. How accessible is that, considering that issues of addiction exist 24 hours? So what happens if somebody calls this line at, say, 4:30 in the afternoon, or if somebody calls in the late evening hours or at night? What happens to them?
Yeah, of course, Wolf. I mean, that's a very important issue, and access to supports and services is, of course, very important. This line just launched. And so we are looking to make sure we can consolidate our practice around this and make sure that we have all of the mechanisms working and make sure that the line is working correctly and people are getting connected in the way that we have anticipated that they will be. And then we are certainly looking at scaling up. We know that it's absolutely critical to provide services for people after sort of normal hours. But perhaps Dr. Ryan could just speak to what happens after 4:30. Can you say that? I want to give you a chance to say a lot of stuff.
Yeah, thanks for the question. Certainly our goal will be that the access line will expand hours eventually. One of the advantages that we have right now, at the minimum, is that we are open 7 days a week. And so this will allow for folks who are working, people who have busy lives during the week that can't attend regular physician appointments, that can't carve out 10 or 15 minutes to make an appointment, that they will have an opportunity to do that 7 days a week on weekends. We're open all statutory holidays. We're open 365 days a year. So that's our starting place, but our goal is certainly to expand the hours when we're able to do so. One of the key components to that is that the connection back to people's community of care. And like it or not, the vast majority of that at this stage happens during kind of working hours. So we will do our best as much as possible to try to accommodate people when they're calling in the line. If anyone calls after hours and leaves us a message, we will of course be calling them back and trying to connect with them as soon as possible. And the goal certainly, and I'm sure that we're going to be successful in increasing the hours of operation of the line in the near future.
Thanks so much, Dr. Ryan. And perhaps I can just leave you with the phone number again, 1-833-804-8111. And anything to our to folks in the media and who are gathered here today that you can do to share out that phone number so that people know how to access the line is greatly appreciated and a real contribution to our efforts to combat this crisis. Thank you so much, everyone, for joining us today.